you don't turn enough, they won't fix it.
Right. They're not gonna, most likely, if the tear is small, the hope is it just simply lays flat. Doesn't repair itself, but it doesn't poke up and start attacking the other cartilage. Because if it's a small tear, chances are it can't flap. The tear has to be big enough that it flaps. And so what'll happen is, like the first time I remember when I tore it, okay? And, you know, when it happened, I was kind of like, oh, that was interesting. Because when you tear cartilage, because there is no blood supply, there's no nerve supply, there's not immediate pain, okay? So, usually what'll happen, you'll feel something that's not quite right, all right? But because there's no immediate pain, you go on about your business, doing your daily stuff, all right? And then, depending on how much more you might abuse that area, okay? The first time, it might end up with some pain where the knee is maybe tight, not moving like it should, okay? And then it'll go away because the flap went back down. So you go on about your business again, okay? Doing whatever it is that you do, okay? And every single time you're doing that, what are you doing to that flap? You're making it bigger. To the point that the knee locks. No matter what you do, nothing's going to fix it. When you go to the doctor, you're probably not even walking on it. Trust me on that, okay? I mean, you go in and you beg them for crutches. And then the knee's probably going to swell up. And then they're going to draw that fluid off. And then they're going to shoot some of the cortisone in there and be like, okay, go get your MRI. They already know what it is, probably. So you go get the MRI. Oh, yeah, you got a torn meniscus. You got to have surgery. What? Okay. All right. But I'm so busy, I can't do surgery for a month. So you got to stay on crutches for a month. Oh, yeah. Was that fun or what? So, menisci. The cruciate ligaments. The ones that form the X, okay? You got one that's anterior, one that's posterior. Collateral popliteal. We're looking at the areas. Now, they're not really showing the one popliteal because that would be on the back, okay? Then, bursa. Now, in the knee, for the bursa, all right, because I wrote the number down, because I just don't walk around with it, you know, stuck in my head. But that right there is our structure. And think about having that needle stuck through all that structure. Yeah, that was my thoughts too. Once again, giving us an idea in this capsule, all right, all these ligaments that we've got creating that capsule. If we go into that capsule, all right, wrapping around the knee, our ACL, PCL that's going to be present, our menisci that are showing up, the connections to or between the femur to the tibia to the fibula, and then if we begin to have some problems with it, going to be fun, and there are at least 13 bursa alone in the knee. At least 13 that they've identified. That's a lot of bursa. Therefore, something goes wrong, a lot of fluid that can build up on the knee. A lot of fluid that can build up on the knee. So, one of the things about this area Notice this one has the most amount of ligaments and stuff that we've seen so far. If we go back, do the comparison between the shoulder to the hip, now to the knee. Do you see the differences in the amounts that are present? Now, if we think the knee is pretty cool, okay, because it is, all right, it's a pretty cool joint, okay? Knee injuries and disorders are going to, be one of the biggest issues that you're probably going to see. If you choose to work like maybe in the ER, probably going to see a lot of it. If you're going into physical therapy, that's going to probably be an area that you're going to work on a lot, is somebody's knee. It accounts for a lot of the surgeries that get scheduled every day. Most of the time, the damage is because of a sport that's being played, all right? Of course, football having the biggest one. In football, usually tearing ligaments is the biggest problem. Those of us, like, for me, when I was, when it happened, that for me was the cartilage, the meniscus, all right? And then, because there are so many bursa that are present, bursitis is huge also in this area. Tend to think, or you tend to have complaints of bursitis more, however, in the shoulder and the hip. All right? Now, something else, because these menisci are so huge, okay, these fibrocartilage that are present. Remember, anytime we hear the term chondro is meaning cartilage. Malacia, usually softening. So, something that is going to be prevalent in knee problems is chondromalacia, a softening in the cartilage, most likely due to abnormal movements of the patella. Ever known people who could like flip that patella? They could just sit there and move that patella left and right, up and down and everything, okay? That's an abnormal movement for that bone. And what it's doing, okay, it's allowing for the situation that leads to the softening of that particular cartilage. You can also find in the knee osteomalacia. Osteo meaning bone, softening of the bones. So you can actually see, for example, because we've got the patella in that tendon, that actually softens. You can actually see articulation between the femur and the tibia and softening of those bones. Another reason that might lead to knee replacement. My mom had both her knees replaced on the same day. Now, I told her, because what I did, if it's me or someone that I know, I am not going to just simply go and have some kind of medical procedure done without looking it up. Okay? YouTube shows everything. All right? I mean, you can find anything on YouTube. So I decided I was going to look up knee replacement, knee surgery. I can handle anything. Okay? Seriously. Think about the stuff I have cut open and cut up. Okay? They're showing the surgeon what they do. Anybody know what they do? Let's just watch. Oh, it's like it. Yes. They come in. Oh, I'm sorry, I forgot to cut off my thing. Y'all can kick me out of class in a minute, okay? Now, go in, saw off ends of the bone. Remove everything that's in between. They take metal bars, and when I say hammer those metal bars up into the bone, down into the bone, and you got to make sure they do it right, or else they're going to break the bones along with having to replace your knee. Okay? So, then they come in and put in the man-made ends, because that's what's on the end of those bars, okay? The man-made cartilage in between, put you back together, sew you up, and go, good luck. And in the meantime, they've cut the entire area. They've cut through all that capsule, all those muscles, everything. And then, toodaloo. And I'm sitting there, and I'm like, especially the part when they were banging the rod into the bone.
What do they do if they break the bone?
Set it, pull the bar back out and start over, and then set it later. And hope morphine's good enough for the patient. Seriously. So it's interesting. It's very interesting, knee replacement surgery, but very common. Sometimes, because of all the structure that's present, blood can build up in the knee, and they term that hemarthrosis, which is it's not very common, but it is something that can occur in the knee.
What about like pain? Okay, so there's like, I get a pain, it feels like it's in my kneecap, and it like comes every now and then, but it will last for a while, and then it'll go away, and then it'll come back, and it's very painful and very achy, but it's like
If it's in your kneecap,
that's what it feels like.
probably. It's very important to keep that patellar tendon stretched. Okay, the more you can keep that stretched, because that's actually going to have nerves in it, and probably it's just not enough stretching. And you may have walked wrong or twisted your knee wrong while walking. It's probably just that. And if you just learned how to keep that patellar tendon stretched, the better your knee will be. The stronger you can get the muscles in your legs, okay, the quads, the hams, okay, the stronger that you can get those, the more relaxed you can have for your IT band, the better it's going to be on the stabilization of that joint, which is very important, even at your age now. Okay, at your age now, it's very important to think about stabilization of those knees. But now, remember, knees are bearing 4 pounds of weight for every pound we are. So if a person weighs 100 pounds, that's 400 pounds weight on the knees. The ankles, 9. So if you weigh 100 pounds, the ankle is bearing 900 pounds of weight. So you would think that this joint would have way more issues than the knees. Granted, definitely one that gets damaged, but here's what happens. The articulation of the bones is really cool and gives a major stabilization to this joint. I don't think I have a representation, but hopefully I can talk about it in the